Hello, 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 Facebook. It's been a minute. I have not been coming on regularly like I should. Well, actually, I was on this weekend for showing everybody. That was on my personal page though. I came on for like 2 minutes this weekend because my little boy was having a birthday party, a sleepover, and he invited 15 people. And I had 15 little boys in my front yard playing football, and so I jumped on to show people the craziness. The people who follow my personal page. Hello, Kathy. Hi, Arak. Is that how you pronounce it? Hello, hello, hello. Guys, ladies, if you could share this video, please. This is an important topic. You know I do this topic once or twice a year. Hi, Tessa. Hi, Tessa. Hi, Tabitha. Hi, Tressa. Hi, Mandy. Thank you for joining me. And I thought I would hardly get anybody on because of the time of day, but I keep wanting to get on, and my daughter is kind of like she's lately been a ball of fire at night, and I haven't been able to get on. I know, Shamika, look at, this is my Pretty RX. Okay, people who place orders for Pretty RX, the pre-orders, I am supposed to get the shipment this week, and as soon as the shipment comes in, we got all the boxes. Let me show you. We got all the boxes ready. We got all the stuff ready. We just need the products to get here. So they're supposed to get here this week. And I've been harassing my manufacturer about expected time of arrival. So I haven't forgotten about you. It's so worth it. Look at my skin. Y'all know I had good skin before I started my products. I was using ZO products, which are amazing products. It's the products that I've been using exclusively in the Darabella since I opened. And I switched over to my products in September, October, October. And it took my skin to a whole nother level. Amazing. So yes, this is makeup free. I have nothing on. This is just lip gloss and a couple of lashes left. I get my lashes done again tomorrow. But yes, so the products are on the way. The first shipment will be here this week. And as soon as they come out, they will be shipped off to the people who ordered. But today's topic is not skin. So I've had like some interesting interactions with people the last couple weeks. And I was gonna go live last week after I had a consult last week with a lady who's a flight attendant and for a major airline. And you know, I always ask people how they hear about me or whatever. And she's like, all her flight attendant friends were like, you have to go to Dr. Myla, which is great. Thanks, flight attendants, for the love. But she was just telling me how one of the flights that she does on a regular basis is from here to the Dominican Republic. And she told me that, and I had no idea about this. It just blew my mind. She was just talking. She's like, I just didn't want to do anything like that because, you know, it scares me. And, you know, she was telling me the stories of the stuff that happens on the plane. People traveling there for surgery, coming back for surgery. And then she said, we're like maybe 10 minutes into the conversation. And then she completely caught me off guard because I wasn't even expecting. I hadn't even thought about this. She says, and we bring at least 3 coffins back a month. I was like, wait, what? She's like, we bring at least 3 coffins back a month from women who went there for surgery and died, and then they have to ship them back. And this airline ships bodies back from the Dominican Republic of women who went there for surgery. And then she started talking about when their families, she's like, and then sometimes we'll have people who have to go to the Dominican Republic to ID the bodies. And a lot of times the girls will have gone and they don't tell their family members, and their family members don't find out until they call and say, can you come and ID this person? And I was like, oh my gosh. She's like, so they usually know ahead of time if that's one of the families, and they like give them extra kind of TLC on the plane or whatever. And then she talked about girls coming back and having issues on the plane from being basically over surgerized there and then not really being in a healthy state on the plane. she talked about girls going back for to try to get fixed by another surgeon after the surgeon that they went to messed them up. So I'm like, okay. I mean, I knew people died. You know, I've talked about this before. We all know it, okay? People do die in the U.S. You're absolutely right, and I will discuss that. But I'm talking about the conversation that I had with this flight attendant, and so she was talking about the stuff that she experiences as a flight attendant who flies back and forth from the Dominican Republic. So that's what I'm talking about right now. So anyway, because you're right, people die in all kind of places, U.S. and abroad. But there's certain places, there's certain types of establishment that have these types of deaths on a regular basis. And the thing that's happened with all these deaths is people have become desensitized to it and they think it's normal. So it is absolutely not normal to have multiple deaths from cosmetic plastic surgery. It's not. All the people that trained me, in the whole time that I was in my training, I don't remember ever witnessing the death of a cosmetic plastic surgery patient. My colleagues that I speak to on a regular basis and have a rapport with and a real relationship with don't have deaths from cosmetic procedures. I have never had a death from cosmetic plastic surgery. It's not normal. So if there's doctors who have deaths on a regular basis, then the question is why? Is it that they're choosing patients inappropriately? Because a plastic surgeon should be operating on people who are optimized. It's not like a cardiothoracic surgeon or a brain surgeon or a general surgeon who has to operate on people who are unhealthy and so is riskier. I'm sure it's Colombia as well. It's more than one place. I'm only talking about what this woman told me of her experiences as a flight attendant on the airline that she flies for, and that is one of the routes that she does. So we're only talking about one person who works for this one airline. That's not even counting the bodies that will come back on other airlines. And that's not counting the bodies that will come back from other places. So I'm telling you about the experience of a person that I just talked to last week who is a flight attendant, okay? So I'm not saying that people only die there. I know people are going to take this and run in all different directions with it. I'm sharing a conversation that I had with one flight attendant for one particular airline who flies the route to Dominican Republic and back on a regular basis. And this is what her experience was. So I'm not going to extrapolate to other places, okay? We all know people can die anywhere. But we also all know that people die in certain places more often than others, and under the hands of certain surgeons more often than others. So my question is, so I had that disturbing conversation last week, and she was like, I don't care how much it costs. I ain't going nowhere like that. Smart lady. Okay. Then I just got an alert to my phone from my YouTube channel, and this lady says, well, my daughter is going to the Dominican Republic, from a video that I did 2 years ago, and I posted it to YouTube 1 year ago. It was called How to Avoid Dying from Plastic Surgery in 2017 is the name of that video. And so she was watching, and I think it's in 3 parts on YouTube. The whole video is in its entirety is on Facebook also. But she made a comment and she said that her daughter was going to the Dominican Republic for her surgery. And this is just, people die from surgery and it's just a normal risk. And, she researched her doctor and she's going to talk to her doctor when she gets there and all this other stuff. And I was just sitting there like, okay, cool. All that's good. I'm glad you researched and all that stuff. But I couldn't imagine taking my daughter somewhere where folks die. Literally, I mean, it's like multiple deaths every month. I couldn't imagine saying, okay, baby, yeah, you just go and get that BBL, and you might die, but it's okay. That comment was so disturbing on so many levels, because I figured, I would think that a mom would be helping her daughter see that maybe if death is a real risk of this procedure, maybe it ain't worth it. I don't get it. And so then for the person who's getting the surgery, I just don't understand. I don't understand why an appearance is so important that you're willing to die to look a certain way. And that's me, a plastic surgeon, saying that. If you, in your heart of hearts, think that there's a real chance that you are not going to wake up, why do you want it so bad? Like, I don't get it. Yes, you're right. Okay, so Kenya, you must have got on late because we just talked about this. She said there's deaths in the U.S. too, Florida especially, so no one should get surgery in the U.S. Nope. See, that's what people do. Jump to all kind of, you just jumped completely off of my subject. I didn't say you shouldn't, I'm not even saying you shouldn't get surgery in the Dominican Republic. I wouldn't. I mean, I just went there and visited, and it was them medical facilities that I drove past. I was scared everywhere that wasn't my resort. I personally wouldn't, but that's me. But I'm not telling people I'm saying don't go to places or doctors who have a chain of deaths behind them that we all know about. Because usually they're coming from the same places. It's the same places and the same people over and over again killing people. That's what I'm saying. And no, you shouldn't go to the places in Florida that have a bunch of deaths. You shouldn't go to the places in anywhere that has a bunch of deaths. There's a lot of those plastic surgery factories is what I call them, where they're doing freaking 10 BBLs a day, and one person can't do 10 BBLs in a day. So then you got to be wondering who's really doing your surgery. And we all have heard about that. People waking up and seeing that the surgeon is not the one doing their surgery, or their family members seeing the surgeon somewhere else when the patient is supposed to be upstairs in the OR with the surgeon, and all kind of stuff. And this is why there would be wide variations in results. If you have a doctor who's knocking it out the park on this one, and then you see these gruesome, horrific pictures of another one, then you should be like, how did the same person do both of those things? That's what I'm saying. So no, I'm not saying don't go anywhere in the U.S. I'm not saying that. That's sarcasm. But you know what? You can go wherever you want to go. I'm not going there. Nobody I love will be going to places where folks are getting killed left and right. If I wouldn't do certain surgeries, I wouldn't do on my family members. And if I had to send them to another plastic surgeon, I wouldn't send them to none of those chop shops that are in Miami. Miami's got some great surgeons too. I wouldn't send them to one of those places that's doing 10 BBLs a day and piling them all up in some of those jacked up recovery houses, and they're sitting up in there like sardines in one room trying to get the cheapest recovery and the cheapest surgery. I wouldn't send my loved ones there. But if you want to go there, go ahead. This video is for the people who give a crap about their life and well-being, and the other ones who want to talk crap, just get off of it and go to where you're going. I'm talking to the people who want to hear it, who actually care about their safety and their well-being in their life. So it doesn't make sense to me. Like I said, if you actually think death is a real complication, like there's a real chance that you're not going to wake up, why the hell would you let them put you to sleep for it? Like, no, nothing is worth that much. I have stuff on my body that I want to change. I have literally, you can ask Amanda.
Yeah.
How many times, okay, y'all, that's Amanda. How many times have I said, I gotta find somebody I want lipo?
I mean, a million.
Like I said every day, I want lipo, but I don't want to die.
What?
I want some freaking lipo, okay? But I don't want to die. I don't want to die. And I'm like, who can I trust? Who can I trust? Who can I trust to do liposuction the way that I do it? Because I feel like some people take too much away, which is why you got all these people walking around with fibrosis and all of this other stuff, and dead skin and dead this and that. That's overdone. And then there's the plastic surgeons that don't take enough. And I'm like, well, shoot. And I need them to take the right amount and not kill me.
Oh, shame.
But since I haven't found the person that I feel like fits those criteria, I still have a big fat belly. And guess what? I'm still fine. I'm still pretty. I still get men in my DMs talking about hey and waving and you're beautiful and all that other stuff with my big old mom belly.
Someone said Okura.
Okay. I'm not willing to die for plastic surgery. I'm just not willing to. So when I find the person that I think, checks off all the boxes that I have as a person in the field, then I'm going to get some lipo too. I'm not about to die for it though. I will walk around with a big fat belly for the rest of my life before I risk my life. Like if I literally thought I was gonna die, I wouldn't get it. I got 3 kids who need me. I have brothers and sisters and a mother and a husband, people who love me. You know, I love myself. I'd rather be my round self and alive than thinner and disfigured or thinner in a coffin. I don't want nobody to be shipping my body back underneath the plane. So all of the sarcasm, this stuff is serious. Like the sarcasm and trying to make a point is not helping nobody. Yeah, I'm not going to, I'm not leaving the United States for my surgery. There's a couple surgeons in Australia, but that I like their work, but I can't, I have a business to run, so I can't like be gone for a month getting surgery. So I have to find somebody in the United States. So anyway, that was what I wanted to talk about. I guess I'm still trying to wrap my brain around the fact that if you really think that you can die from it, why are you getting it? Is the question. Okay, it looks like somebody got a block over here. Wait a minute, did I just see a curse word?
Yep.
Where is it at?
I had one up ahead from you.
Let me see, where's she at? You know you doing something when you got trolls, y'all. Look, I knew all of the DR girls was gonna come out for this one. Guess what? I really don't care about what anybody thinks of what I say because I'm confident in myself. My patients love me. My family loves me. My staff loves me. So if you don't like me, exit. Bye. Okay, let me see. Who I need to block?
I just saw it. I can't get to it.
Okay, there's a blocked one. There go another one. My name is Dr. Myla Bennett of Adarabella Plastic Surgery and Medical Spa in Johns Creek, Georgia. Death is guaranteed. We all are going to die at some point. I personally don't want to die. I don't want my kids to have to grow up and say, my mom died getting plastic surgery. But everybody do what you think is best for you. That's it. But like I said, I do these videos for the people who care about their lives and want to be safe. And it's nothing wrong with plastic surgery, obviously. I don't think anything's wrong with it. I do it for a living. I don't want everybody to come to me. There are people who are clearly not designed to be my clients. I turn people down. I'm not doing this to get you to come to me instead of going to the DR. Because 9 times out of 10, a person who's planning to go to the Dominican Republic for surgery wouldn't pay my prices. I know they're not my client. It's fine. I have no problem with that. I just don't want you to be dead. You don't even have to like me, but I would like you to be alive to know that you don't like me and not die getting a freaking BBL. That's ridiculous. So, all right, y'all. That was really all I wanted to say. I'm surprised I got this many people on in the middle of the day.
It's a really good time. Ask me when it's a good time for them.
Yeah. Okay, I gotta run, y'all. I gotta work out since I can't get lipo right now. I'm about to work out with my trainer. All right, so I am Dr. Myla Bennett of Adarabella Plastic Surgery and Medical Spa in Johns Creek, Georgia. You can reach me via my website at www.adarabella.com. Or you can call my office at 678-325-0006. All right, everybody. Bye.